Welcome to the 9th online lecture of Clinical Pharmacy, 4th Professional. In our previous lecture we understood the concept of primary literature and also compared it with other types of literature in order to clear our understanding about all three types of the literatures. Today we will go a bit deep into primary literatures. Evidence-based medicine aims to optimize decision-making by using evidence from well-designed and conducted research. The concept of reliable evidence is essential, since the number of electronic information resources is increasing in parallel to the increasing number and type of drugs on the market. Decision-making process is a complex process and requires an extensive evaluation as well as the interpretation of the data obtained. The evidences obtained from different types of studies provide different levels of evidence for decision-making. This slide should provide you level of evidences for different types of primary literature. With reference to level of evidence, we leave it up till here. First we would see the classification of primary literature so that we would also be able to briefly provide description of each type of primary literature. From this point onwards, the lecture introduces the different kinds of studies commonly used in medical research. Because we believe that knowing how a study is designed is important for understanding the conclusions that can be drawn from it, I have chosen to devote considerable attention to the topic of study designs. You might think that this is too much detail for you, but I believe as a student of pharmacy, and particularly of clinical pharmacy, this is going to help you a lot. Now that you are a bit familiar with the medical literature, you will recognize many of the terms used to describe different study designs. If you are just beginning to read the literature, you should not be dismayed by all the new terminology. There will be ample opportunity to review and become familiar with it. We will also review each type briefly but with sufficient information for your complete understanding. There are several different schemes for classifying study designs. We have adopted one that divides studies into those in which the subjects were merely observed, sometimes called observational studies, and those in which some intervention was performed, generally called experiments. This approach is simple and reflects the sequence an investigation sometimes takes. With a little practice, you should be able to read medical articles and classify studies according to the outline in this slide with little difficulty. I have also made comparatively easier chart for you to follow on this slide. However, we will stay at this slide for a while as it contains few examples as well. Again, note that there are four main categories of clinical studies. Two of these studies are based on presence or absence of any intervention, that is, observational and experimental studies. Now let's start to study each study individually. When certain characteristics of a group, or series, of patients, or cases, are described in a published report, the result is called a case series study. It is the simplest design in which the author describes some interesting or intriguing observations that occurred for a small number of patients. Case series studies frequently lead to the generation of hypotheses that are subsequently investigated in a case control, cross-sectional, or cohort study. For example, Azevedo et al. Reported 2 cases of isolated gastrointestinal tuberculosis in renal transplant recipients that illustrated the difficulty of making this diagnosis. They also provided a brief review of the literature on its clinical presentation, diagnosis, and therapeutic approach. The reference of this case series is given here. You can check it for your learning purpose. You already know what a hypothesis is, right? Let me refresh it for you. Hypothesis is a supposition or proposed explanation made on the basis of limited evidence as a starting point for further investigation. Case control studies begin with the absence or presence of an outcome and then look backward in time to try to detect possible causes or risk factors that may have been suggested in a case series report. The cases in case control studies are individuals selected on the basis of some disease or outcome. The controls are individuals without the disease or outcome. The history or previous events of both cases and controls are analyzed in an attempt to identify a characteristic or risk factor present in the case's histories but not in the control's histories. The figure in this slide indicates that subjects in the study are chosen at the onset of the study after they are known to be either cases with the disease or outcome, shown in squares, or controls without the disease or outcome, these are shown in diamonds. The histories of cases and controls are examined over a previous period to detect the presence, shaded areas, or absence, unshaded areas, of predisposing characteristics or risk factors, or, if the disease is infectious, whether the subject has been exposed to the presumed infectious agent. In case control designs, the nature of the inquiry is backward in time, as indicated by the arrows pointing backward in figure to illustrate the backward, or retrospective, nature of the research process. We can characterize case control studies as studies that ask what happened. In fact, they are sometimes called retrospective studies because of the direction of inquiry. Case control studies are longitudinal as well, because the inquiry covers a period of time. Cohort and case control studies generally involve an extended period of time defined by the point when the study begins and the point when it ends. Some process occurs, and a certain amount of time is required to assess it. For this reason, both cohort and case control studies are sometimes also called longitudinal studies. As such, controls should also be selected carefully. It is possible to match controls to the cases selected on the basis of various factors, for example age, gender, to ensure these do not confound the study results. Case controls can provide fast results and they are cheaper to perform than most other studies. The fact that the analysis is retrospective allows rare diseases or diseases with long latency periods to be investigated. Furthermore, you can assess multiple exposures to get a better understanding of possible risk factors for the defined outcome, disease. As case controls are retrospective, they are more prone to bias. One of the main examples is recall bias. Often case control studies require the participants to self-report their exposure to a certain factor. Recall bias is the systematic difference in how the two groups may recall past events. For example, in a study investigating stillbirth, a mother who experienced this may recall the possible contributing factors a lot more vividly than the mother who had a healthy birth. Example of this study may be given as, Heitz et al. Reviewed their data on critically ill obese patients who were treated with a broad-spectrum lactam in whom therapeutic drug monitoring was performed and compared the data to those obtained in critically non-obese patients to assess whether there were differences in reaching optimal drug concentrations for the treatment of nosocomial infections. You can find this study and further explore to understand case control study. The third type of observational study goes by all of the following names: cross-sectional studies, surveys, epidemiologic studies, and prevalence studies. We use the term cross-sectional because it is descriptive of the timeline and does not have the connotation that the terms surveys and prevalence do. Cross-sectional studies analyze data collected on a group of subjects at one time rather than over a period of time. Cross-sectional studies are designed to determine what is happening right now. Subjects are selected and information is obtained in a short period of time because they focus on a point in time. They are sometimes also called prevalence studies. Surveys and polls are generally cross-sectional studies, although surveys can be part of a cohort or case control study. Cross-sectional studies may be designed to address research questions raised by a case series, or they may be done without a previous descriptive study. For example, McGowan and colleagues carried out a cross-sectional survey amongst people who use drugs in London. The main outcome measure was any albuminuria, including both microalbuminuria and macroalbuminuria. This is a recently published study. Find out more about this study with given bibliography. Surveys are especially useful when the goal is to gain insight into a perplexing topic or to learn how people think and feel about an issue. Surveys are generally cross-sectional in design, but they can be used in case control and cohort studies as well. Interviews are sometimes used in surveys, especially when it is important to probe reasons or explanations more deeply than is possible with a written questionnaire. For example, Vihakam and Hamza determined the prevalence and correlates of burnout among undergraduate medical students through a cross-sectional survey. A cohort is a group of people who have something in common and who remain part of a group over an extended time. In medicine, the subjects in cohort studies are selected by some defining characteristic, or characteristics, suspected of being a precursor to or risk factor for a disease or health effect. Cohort studies ask the question what will happen? And thus, the direction in cohort studies is forward in time. The figure in this slide illustrates the study design. Researchers select subjects at the onset of the study and then determine whether they have the risk factor or have been exposed. All subjects are followed over a certain period to observe the effect of the risk factor or exposure. Because the events of interest transpire after the study is begun, these studies are sometimes called prospective studies. A classical cohort study with which most of you are probably familiar is the Framingham study of cardiovascular disease. This study was begun in 1948 to investigate factors associated with the development of atherosclerotic and hypertensive cardiovascular disease, for which Gordon and Cannell reported a comprehensive 20-year follow-up in 1970. Many journal articles have been written about this cohort, and some of the children of the original subjects are now being followed as well. Although the Framingham Heart study is very long-term, many cohort studies follow subjects for a much shorter period. For example, Blint and co-workers examined outcomes of patients presenting to a pediatric emergency department over a 1-year period. The primary outcome was the proportion of patients with an adverse event related to emergency department care within 3 weeks of their visit. Many cohort studies are prospective, that is, they begin at a specific time, the presence or absence of the risk factor is determined, and then information about the outcome of interest is collected at some future time, as in the 2 studies described earlier. One can also undertake a cohort study by using information collected in the past and kept in records or files. Suppose investigators wanted to test the hypothesis that working with the chemicals involved in tire manufacturing increases the risk of death. Since this is a fairly rare exposure, it would be advantageous to use a special exposure cohort text annotation indicator such as employees of a large tire manufacturing factory. The employees who actually worked with chemicals used in the manufacturing process would be the exposed group, while clerical workers and management might constitute the unexposed group. However, rather than following these subjects for decades, it would be more efficient to use employee health and employment records over the past 2 or 3 decades as a source of data. In essence, the investigators are jumping back in time to identify the study cohort at a point in time before the outcome of interest, death, occurred. They can classify them as exposed or unexposed based on their employment records, and they can use a number of sources to determine subsequent outcome status, such as death, for example, using health records, next of kin, national death index, etc. Both case control and cohort studies evaluate risks and causes of disease, and the design an investigator selects depends in part on the research question. Generally speaking, results from a well-designed cohort study carry more weight in understanding a disease than do results from a case control study. A cohort study starts with a risk factor or exposure and looks at consequences. A case control study takes the outcome as the starting point of the inquiry and looks for precursors or risk factors. In spite of their shortcomings with respect to establishing causality, case control studies are frequently used in medicine and can provide useful insights if well designed. They can be completed in a much shorter time than cohort studies and are correspondingly less expensive to undertake. Case control studies are especially useful for studying rare conditions or diseases that may not manifest themselves for many years. In addition, they are valuable for testing an original premise. If the results of the case control study are promising, the investigator can design and undertake a more involved cohort study. We have completed observational studies. Now start with experimental studies. Experimental studies are those studies in which any type of experiment is involved. Experimental studies are generally easier to identify than observational studies in the medical pharmaceutical literature. Experimental studies in medicine that involve humans are called clinical trials because their purpose is to draw conclusions about a particular procedure or treatment. We have previously seen that clinical trials fall into 2 categories, those with and those without controls. Controlled trials are studies in which the experimental drug or procedure is compared with another drug or procedure, sometimes a placebo and sometimes the previously accepted treatment. Uncontrolled trials are studies in which the investigator's experience with the experimental drug or procedure is described, but the treatment is not compared with another treatment, at least not formally. Because the purpose of an experiment is to determine whether the intervention, treatment, makes a difference, studies with controls are much more likely than those without controls to detect whether the difference is due to the experimental treatment or to some other factor. One way a trial can be controlled is to have 2 groups of subjects. One that receives the experimental procedure, the experimental group, and the other that receives the placebo or standard procedure, the control group. The experimental and control groups should be treated alike in all ways except for the procedure itself so that any differences between the groups will be due to the procedure and not to other factors. The best way to ensure that the groups are treated similarly is to plan interventions for both groups for the same time period in the same study. In this way, the study achieves concurrent control. To reduce the chances that subjects or investigators see what they expect to see, researchers can design double-blind trials in which neither subjects nor investigators know whether the subject is in the treatment or the control group. When only the subject is unaware, the study is called a blind trial. In some unusual situations, the study design may call for the investigator to be blinded even when the subject cannot be blinded. Before we see randomized control trials, let's recall what a randomization is. We say it randomized when every patient in the population has an even chance and likelihood of being selected in the clinical study. The randomized controlled trial is the epitome of all research designs because it provides the strongest evidence for concluding causation. It provides the best assurance that the result was due to the intervention. The randomized clinical trial is the gold standard, or reference, in medicine. It is the design against which others are judged, because it provides the greatest justification for concluding causality and is subject to the least number of problems or biases. Clinical trials are the best type of study to use when the objective is to establish the efficacy of a treatment or a procedure. Clinical trials in which patients are randomly assigned to different treatments, or arms, are the strongest design of all. One of the treatments is the experimental condition, another is the control condition. The control may be a placebo or a sham procedure. Often, it is the treatment or procedure commonly used, called the standard of care or reference standard. For example, Borbo et al. Evaluated the safety and efficacy of chloroquine diphosphate dosages in patients with severe coronavirus in a parallel, double-masked, randomized clinical trial. You should explore more clinical trials to enhance your understanding with clinical trials of different designs. Subjects are not always randomized to treatment options. Studies that do not use randomized assignment are generally referred to as non-randomized trials or simply as clinical trials or comparative studies, with no mention of randomization. Many investigators believe that studies with non-randomized controls are open to so many sources of bias that their conclusions are highly questionable. Studies using non-randomized controls are considered to be much weaker because they do nothing to prevent bias in patient assignment. You can refer to the recent example of open-label non-randomized clinical trial of hydroxychloroquine and erythromycin as a treatment of coronavirus. A moderate level of control can be obtained by using the same group of subjects for both experimental and control options. The study by Sota and colleagues, in 2002, involved patients who underwent cholecystectomy. Follow-up occurred 1 and 3 months after cholecystectomy to detect changes such as abdominal pain, flatulence, and dyspepsia. This type of study uses patients as their own controls and is called a self-controlled study. Studies with self-controls and no other control group are still vulnerable to the well-known Hawthorne effect, in which people change their behavior and sometimes improve simply because they receive special attention by being in a study and not because of the study intervention. These studies are similar to cohort studies except for the intervention or treatment that is involved. The self-controlled study design can be modified to provide a combination of concurrent and self-controls. This design uses two groups of patients. One group is assigned to the experimental treatment, and the second group is assigned to the placebo or control treatment, as shown in the figure on this slide. After a time, the experimental treatment and placebo are withdrawn from both groups for a washout period. During the washout period, the patients generally receive no treatment. The groups are then given the alternative treatment, that is, the first group now receives the placebo, and the second group receives the experimental treatment. This design, called a crossover study, is powerful when used appropriately. The third method for controlling experiments is to use controls external to the study. Sometimes, the result of another investigator's research is used as a comparison. On other occasions, the controls are patients the investigator has previously treated in another manner, called historical controls. The study design is illustrated in the figure. Historical controls are frequently used to study diseases for which cures do not yet exist and are used in oncology studies, although oncologic studies use concurrent controls when possible. In studies involving historical controls, researchers should evaluate whether other factors may have changed since the time the historical controls were treated. If so, any differences may be due to these other factors and not to the treatment. Review articles can be divided into systematic reviews and non-systematic or narrative reviews. Narrative reviews summarize previously conducted research but do not specify the methods used to identify and summarize the information. Systematic review is a comprehensive overview of original information that involves precise methods, that is, methodological quality, precision, external validity, of identifying and rejecting studies to be included in the review. As a result of these methods, the information evaluated has limited bias and reliable results. For articles reviewing drug therapy, systematic reviews typically are preferred over narrative reviews. We have studied review articles in tertiary literature. Here are we only comparing simple review articles with systematic reviews which obviously belong to primary literatures. A type of study that does not fit specifically in either category of observation studies or experiments is called meta-analysis. Meta-analysis uses published information from other studies and combines the results so as to permit an overall conclusion. Meta-analysis is similar to review articles, but additionally includes a quantitative assessment and summary of the findings. It is possible to do a meta-analysis of observational studies or experiments. However, a meta-analysis should report the findings for these two types of study designs separately. This method is especially appropriate when the studies that have been reported have small numbers of subjects or come to different conclusions. Yes, since pharmacists constantly are relied upon to provide drug information, being knowledgeable of the information or knowing where to obtain information is pertinent for daily practice. This is the end of this lecture. Next, we will study the literature evaluation. Thank you and stay blessed.